Hello, this is Joe Yuhan here talking about pelvic mobility. And in part 3, we're going to talk about how we monitor or assess for pelvic alignment and motion, and then strategies that you can try at home to enhance and improve your pelvic mobility. And so we talked in parts 1 and 2 about how the pelvis is supposed to move. I'm going to continue to employ these because it's very often easier to see. And so here's a little preface. Any highly skilled manual sports medicine practitioner should be well versed in how to assess both the alignment and the mobility of the pelvis. It's so important. Some of them may not necessarily always go there in the way that they should, but a skilled manual sports medicine person should know how to do this. Unfortunately, there's not a lot of us out there. And there's even fewer that really are looking into this. And so, sort of on theme with a lot of my works for you guys is I want to empower you, and sometimes I want to kind of empower you to challenge your medical professional and say, you know what, like, can you look at how my pelvis is aligned and look at my pelvic motion? And I know that there's some of my fellow practitioners out there too that could benefit from just a refresher on how important it is to assess this. So either way, this may be like maybe too complicated, but in some respects, I'm going to try to keep this really simple in terms of what to look for just from a straight up alignment standpoint. And so the first thing, the biggest thing is that there's sort of a maxim in manual physical therapy that if something is out of alignment and neutral, pretty sure if something is off, just standing in the middle, not moving, chances are it's not going to do the right thing when you're out doing your athletic sport. And so if you find something in this in just a standing or a laying down position, it's probably relevant. But we're going to couple both a sort of alignment check with some mobility things. So the first thing that you can do is just put your hands on your hips, so to speak. So again, hips in quotes, because really what you're looking at is the top of the pelvis, the top of the ilium bone. And what you want to be able to see with your hands is these pelvic bones even. And this can be hard to see. So sometimes you can't quite see this in the mirror. Or sometimes you kind of get fooled by clothing. So it can help to have, a friend or a partner or somebody kind of look at these things for you or take your picture. But this is what you want to first do, is to get your hands on the top of the iliac crest. You come up to that waist, and then you sink in immediately. And then you kind of sink in, you sink down, and those are the tops of your pelvis. Those bones should be even. If you're standing here and one of them is way up here, then that represents a potential issue. And it doesn't necessarily mean that this is the painful side. The pain or the issue could be on the opposite side because this maybe isn't moving and then this is getting beat up as a result. So that is the iliac crest. That's the easiest one to look at. Again, your side view is getting onto the side here, and then the iliac crest more or less ends where my thumbs are here. Now, one metric isn't really good enough for sort of reliability, so we want to have 3. So after that, where you're going to want to go is there is a bone on the front of the pelvis. It's called the anterior superior iliac spine, and it's sort of about the size of a thumb, and it runs vertically. And so what you can do is find that bone and just feel for where it drops off. And then where it drops off, stick your thumb there, and again, looking at that relative height. And so what that height will tell you is whether or not there is either an elevation or a relative rotation of that bone. Again, it can be kind of difficult to see, and so you can take your picture or have somebody else kind of do an assessment for you. The last one then to really sort of triangulate is on the back side. And so I'll show you guys this just sort of as a review. So again, on the real skeleton, here is the waist or the iliac crest. This right here, this little nub in the front, That's your anterior superior iliac spine. On the back, our last one is the posterior superior iliac spine. So to find that, again, it's sort of like a thumb size, and that represents the back side of the pelvis. You can come onto the back, and you'll just find these two sort of bony points. If you're really confused, you can start and go all the way down to that ischium, or the sit bone, and then come up. And then, of course, you'll be too high if you get up to the pelvic rim here. So again, this you can't see. So again, it's going to be, you could maybe look in the mirror, have a friend or a partner take your picture. And same thing, you want to look and see and make sure that these are even. And if you have that data, then you know, A, is something off, B, generally what is it doing? And so if this is high, and this is high, and this is high, you can probably guess that you have one pelvis bone that is universally just elevated. It's an elevated pelvis, or sometimes called an upslip. However, if you have one that's high on the side, high on the back, but low on the front, that is a pelvis that's stuck one-sided into anterior rotation or extension. So really simple, but again, like at a sports medicine level assessment of your pelvis. But if you're uncertain, and especially if something's not feeling right in your stride, that's a really nice starting point of something to look at. So if you have that, the next step is going to be looking at performance mobility. I covered this in some previous columns that we're going to link in the article, but things like laying down, doing knee to your chest, doing a runner's lunge-like stretch to assess flexion, relative flexion and extension mobility of the pelvis, and then lateral movements like doing sort of a side lunge or a hurdler stretch will help assess the opening and closing of the pelvis, as well as aspects of rotation. So if you have those two things, if you feel there's an asymmetry of the pelvis in standing and alignment, and a movement asymmetry or range of motion loss, now it's time to go after it. And really at this point, I would strongly recommend it that if you guys have a good sports medicine practitioner. I'm partial to the physiotherapist because I feel like we can do it all, from joint mobilization manipulation to soft tissue work. I think that's your best bet to go to them, because they're going to really kind of help you figure out, okay, well, where exactly is this bone, aligned or not moving right, and what can we do? Then again, we have to go back to what's really causing it as well. Is it soft tissue? Is it nerve tension? When it's those sorts of things, it's likely to come back. But let's say you don't have that capacity, what can you do? And so one of the first things that you can do is soft tissue mobilization. And so grabbing something here quick. We have a couple different things we can do, but something as simple as just like a massage ball, it could be hard or it can be soft, to work the contours around the pelvis. So let's say that you have an elevation where this pelvis is stuck up. The first thing that you want to do is to check the soft tissue around that pelvis. And so one of the things you can do, which again we covered in a self-mobilization strategy video previously, but you can take that ball against a wall and massage sort of the contours of this bone to just make sure that there aren't muscles, fascia, or other things that are adhering and pulling this bone in an elevated position. So for me, I could get up against the wall, lean up against that, and just kind of scour the top of my pelvis to make sure that it's free, identifying any hot spots and just sinking in there. That is a really nice starting point. But one of the most overlooked components then is the viscera. So again, what if this pelvis is elevated or rotated because this large intestine is sticky? That's a little bit more challenging. I wrote in a previous column, in a previous video, on different strategies to do stretching techniques of the belly. There are also massage balls out on the market, specially designed massage balls that are soft and larger that you can lay on and sink in, and they will help stretch that intestine off of the pelvis, for example. Really important stuff to make sure that the pelvis is actually free to move. Then you can go into more of the standard stretches, whether it's runner's lunge or side lunge or some of these other things to really ensure that the pelvis is moving in the right way. So those are some great strategies. But again, this component is really intended to help you realize, okay, is this an issue? Because if it is, I do think that you're better off really having comprehensive care on this. But if nothing else, I hope that this is going to be a useful tool to help you figure out, is my pelvis off, and could that be something that's perpetuating a hip pain, a hamstring pain, a knee pain, or even a foot pain? So check those things out, give them a try, and good luck.